Degenerative disc disease (DDD) is an orthopedic disease. Look at this picture, shows that degenerative disc CT finding, MRI findings. Look at that picture, and X-ray findings. Look at this. A detail going on. Introduction. Degenerative disc disorder is a common spinal condition that affects millions of individuals worldwide. Despite its name, DDD is not a true disease but rather a term used to describe the natural wear and tear of the intravertebral disc in the spine over time. This degeneration can lead to pain, reduced mobility, and other complications that significantly impact a person's quality of life. Definition: degenerative disc disease refers to the progressive deterioration of the intervertebral disc, which are the soft, gel-like caissons situated between the vertebra in the spine. The disc acts as shock absorbers, allowing for flexibility and movement. As individuals age, these discs can lose their hydration, elasticity, and height, leading to decreased spinal function and potential pain. Types: DDD can manifested in various forms, primarily categorized based on location and nature of degeneration. 1. Cervical DDD affects the neck region, particularly causing neck pain, stiffness, and radiating pain into arms. 2. Thoracic DDD involves the mid-back, which is less common but can cause localized pain and discomfort. 3. Lumbar DDD occurs in lower back and is the most prevalent form, often resulting in lower back pain and sciatica. Additionally, DDD can be classified based on specific disc changes. 1. Disc herniation, the nucleus pulposus protrudes through the annulus fibrosis, potentially compressing nearby nerves. 2. Disc bulging. The disc extends beyond its normal boundary but remains contained within the annulus. 3. Annular tears. Micro tears in the annulus fibers that can lead to pain and instability. Causes: Several factors contribute to the development of degenerative disc disease. One, aging. Natural aging process lead to the loss of water content in disc, reduce their cushioning ability. 2, genetics. Hereditary factors can predispose individuals to earlier or more severe disc degeneration. 3, mechanical stress. Repetitive movements, heavy lifting and poor posture can accelerate disc wear. 4, injury. Trauma to the spine such as from accidents or sports can damage disc and initiate degeneration. 5, lifestyle factors. Smoking, obesity and lack of exercise can exacerbate disc degeneration by reducing blood flow and increasing spinal stress. Risk factors. Understanding the risk factors for DDD can aid in prevention and early intervention. 1, age. Risk increases significantly after the age of 30. 2, genetic predisposition. Family history of spinal issues can elevate risk. 3, occupational hazards. Job involving heavy lifting, bending or twisting motions. 4, sedentary lifestyle. Lack of physical activity, weakness, supporting muscles, increasing spinal strain. 5, smoking. Impair blood flow to spinal discs, accelerating degeneration. 6, obesity. Excess body weight places additional stress on the spine. Complications. If left untreated, DDD can lead to several complications. 1, chronic pain, persistent discomfort that affects daily activities and quality of life. 2, nerve compression. Herniated disc can press on spinal nerves, causing pain, numbness or weakness in limbs. 3, spinal stenosis. Narrowing of the spinal canal due to disc and bone changes potentially lead to mobility issues. 4, spondylolisthesis. Slippage of one vertebrae over another, causing instability and pain. 5, decreased mobility, reduced flexibility and range of motion in the spine. Pathophysiology. The pathophysiology of degenerative disc disease involves serious or progressive changes in the structure and function of intravertebral disc and surrounding spinal components. Here is a step-by-step breakdown of process. 1, disc dehydration and loss of proteoglycan content. Initial stage, aging or injury causing. 2, loss of disc height. 3, structural weakness of the annulus fibrous, formation of microtears and disc bulging. 3, disc herniation. 5, inflammatory response. 6, degeneration of adjacent structures. facet joint degeneration, ligament thickening. 7. Osteophytes formation, bone spurs. 8. Spinal stenosis. 9. Decreased mobility and spinal instability. 10. Chronic pain and disability. These processes work together to gradually deteriorate spinal function and contribute to the symptoms and associated with degenerative disc disease. Signs and symptoms. DDD presents with a range of symptoms which can vary based on disc location and severity of degeneration. 1. Chronic back or neck pain, persistent discomfort in the affected spinal region. 2. Radicular pain, pain radiating to limbs. 3. Numbness or tingling sensation in areas served by compressed nerves. 4. Muscle weakness, weakness in muscles innervated by affected nerves. 5. Stiffness, reduced flexibility and increased resistance to movement. 6. Pain, aggravated by activity. Symptoms worsen with certain movements or prolonged activity. 7. Pain relief with rest. Symptoms may improve with rest or reduced activity. Diagnosis. Diagnosing DDD involves a combination of clinical evaluation and imaging studies. 1. Medical history and physical examination. Assessment of symptoms, medical history and physical signs such as tenderness, range of motion and neurological defects. B. Imaging studies. 1. X-ray reveals disc space narrowing, osteophyte formation and spinal alignment. 2. MRI magnetic resonance imaging provides detailed images of soft tissues including disc, nerves and spinal cord. 3. CT scan computerized tomography offers comprehensive bone detail and can identify disc herniation. 4. Disc echography involves injecting dye into the disc to assess pain response and disc integrity. 5. Electromyography evaluate nerve function and can detect nerve compression. 6. Bone scans less commonly used but can identify bone abnormalities associated with spinal degeneration. Nursing diagnosis for patients with degenerative disc disease focus on addressing both physical and psychosocial aspects. 1. Chronic pain, persistent pain related to disc degeneration and nerve compression. 2. Impaired mobility, limited movement due to pain and spinal stiffness. 3. Risk for impaired skin integrity, especially in cases requiring prolonged bed rest or immobility. For anxiety related to chronic pain and potential disability. 5. Depression due to persistent pain and reduced quality of life. 6. Knowledge deficit, lack of understanding about condition, management and prevention strategies. 7. Risk for injury, increased vulnerability to falls or accidents due to impaired mobility. Management and treatment. Effective management of DDD requires a multidisciplinary approach combining medical, physical and psychosocial strategies. A non-surgical management. Medications. 1. Analgesics or the counter pain relief like acetaminophen. 2. Non-steroidal anti-inflammatory drugs reduce pain and inflammation. 3. Muscle relaxations alleviate muscles spasms. 4. Neuropathic pain agents such as gabapentin for nerve related pain. 2. Physical therapy. 1. Strengthening exercises build supportive musculature around the spine. 2. Flexibility training, improve range of motion and reduce stiffness. 3. Posture training, current poor posture to alleviate spinal stress. 4. Low impact aerobic conditioning, enhance overall fitness without overstraining the spine. 3. Lifestyle modifications. 1. Weight management, reduce spinal load by maintaining healthy weight. 2. Massage therapy, alleviate muscle tension and promotes relaxation. 4. Bracing, use of spinal braces to provide support and limit motion, reducing pain. B. Surgical management, when conservative treatment fail to relieve symptoms or when there are significant neurological defects, surgical options may be considered. 1. Discotomy or microdiscotomy, removal of the herniated portion of the disc to relieve nerve compression. 2. Spinal fusion, joining 2 or more vertebrae to stabilize the spine. 3. Artificial disc replacement, replacing the degenerated disc with an artificial one to maintain spinal mobility. 4. Laminectomy, removal of part of vertebrae to relieve pressure on the spinal cord or nerves. 5. Vertebroplasty, minimally invasive procedure to stabilize vertebral fractures if present. Psychosocial medicine, chronic condition like DDD can have profound psychosocial impacts. A. Mental health. 1. Depression and anxiety. Persistent pain and disability can lead to mood disorders. 2. Stress. Coping with chronic pain and lifestyle changes increases stress levels. B. Social impact. 1. Isolation. Reduced mobility and pain can limit social interactions. 2. Employment challenges. Inability to perform job duties may lead to unemployment or reduced work capacity. C. Quality of life. 1. Daily functioning. Chronic pain can impede daily activities, affecting overall well-being. 2. Sleep disturbances. Pain can interfere with sleep, leading to fatigue and reduced cognitive function. D. Support system. 1. Family and friends. Essential for emotional support and assistance with daily activities. 2. Support groups. Connecting with others experiencing similar issues can provide coping strategies and reduce feeling of isolation. E. Coping mechanisms. 1. Psychotherapy. Cognitive behavioral therapy can help manage pain perception and develop effective coping strategies. 2. Mindfulness and relaxation techniques. Practices like meditation and deep breathing can alleviate stress and improve pain management. Prevention. Preventing degenerative disc disease involves adopting lifestyle and ergonomics practices that minimize spinal stress and promote overall spinal health. A. Regular exercise. Strengthening core muscles enhances spinal support. 2. Flexibility exercises. Maintaining range of motion and reduce stiffness. A. Aerobic activities. Promotes overall fitness and weight management. B. Proper lifting techniques. 1. Use of leg, not back. Lift with legs to reduce spinal strain. To avoid twisting, keep the spine in a natural position during lifting. 3. Use of assistive devices. Utilize tools like dollies or lifting steps when necessary. C. Healthy weight management. Reduces the load on the spine, preventing excessive wear. D. Smoking cessation. Improving blood flow to spinal disc and delays degeneration. E. Ergonomic workplace setup. 1. Proper chair support. Use chairs that support the lower back. To maintain height, position screens at eye level to maintain natural neck posture. 3. Frequent breaks. Avoid prolonged sitting by taking regular movement breaks. F. Balanced nutrition. Adequate hydration support disc hydration and health. To calcium and vitamin D strengthen bone and support spinal integrity. G. Posture awareness. 1. Maintaining neutral spine, avoid stretching and maintain proper alignment during activities. To use of supportive devices, lumbar pillows or supports on help maintain posture. In conclusion, degenerative disc disease is a multi-factored condition resulting from the natural aging process and various lifestyle factors. While it can lead to significant discomfort and disability, understanding its causes, risk factors, and manifestations allows for effective management and prevention strategies, early diagnosis, and a comprehensive multidisciplinary approach to treat can mitigate symptoms, enhance quality of life, and prevent complications. Emphasizing prevention through healthy lifestyle choices and ergonomic practices is essential in reducing the prevalence and impact of DDD. With advancements in medical treatments and increased awareness, individuals can better navigate the challenges posed by degenerative disc disease and maintain spinal health throughout their lives. Thank you. Have a nice day.